Since I came to Lebanon about a year and a half ago, actually, back from the United States, and I feel that we live in this country in a big prison where we are being tortured every day, unnecessary torture. And the reason I feel that way is because I'm faced every day with patients in severe pain telling me I don't want to be in pain, yet I feel I cannot help them. I'm faced with friends and relatives sitting at home suffering from real severe pain I cannot help. Now, each one of you had suffered or will suffer one day some kind of pain. It could be a surgery that you go through. It could be a fracture after a car accident or while skiing, for example. It could be a toothache, a migraine headache, or a back pain from a bulging disc. It could be really anything. And this pain could be so severe and would last days and weeks. And if you live in Lebanon, the only medications you can get to treat that pain is Panadol or paracetamol, or some non-steroidal anti-inflammatory drugs like ibuprofen or Advil, and at best some tramadol. But WHO tells us that these medications are for the treatment of mild and moderate pain. They're not for the treatment of severe pain. And WHO tells us for severe pain, you need to have access for potent opiates like morphine. The problem is, if you're sitting at home in Lebanon suffering from severe pain, you do not have access to morphine. And that's what my talk is about today. If you're at the hospital, there's no problem with that. You have an IV, they give you IV morphine, no problem. But what if you're at home suffering from severe pain? If you have a severe toothache at home, you're not going to get admitted to the hospital to get IV morphine. That's the main problem in Lebanon. So what is severe pain? So let's define it first. So anytime you're suffering from pain, you ask yourself the question from 0 to 10, 0 there is no pain at all, and 10 is the worst pain you could ever imagine, where is your pain score? Anytime you rate yourself more than 6 over 10, this is severe pain, and WHO tells you you need to take morphine for that or any other potent opiate. So why I'm not able to help my patients in Lebanon? First of all, because when I was practicing in the States, I had a choice of 10 different potent opiates I could prescribe to my patients. Here I come to Lebanon, we have only one of them on the market. The other problem I have is I cannot prescribe it. Because according to the Lebanese law, you have anyone who needs to have morphine should have a prescription signed by 2 physicians. One of them should be an oncologist, meaning you need to have cancer to have pain, to have morphine. And the other physician should be a pain specialist, meaning someone who has a fellowship in pain management. And we have less than 20 of those in Lebanon. A pain specialist, actually, people do consult them for chronic pain management, not for acute pain. For example, if you have a back pain for many months, or sciatica, for example, you go consult a pain specialist so he'll give you an injection to that nerve that's hurting you, or they do rhizotomy for that nerve. Their job is not to prescribe morphine for acute pain, but this is the law in Lebanon, unfortunately. The International Narcotic Control Board is an independent monitoring body. They go to each country and they see how much morphine equivalent this country is using. And if you're not using enough morphine equivalent, they tell this country, you're not treating your pain well. As simple as that. Just to give you an idea how severe the problem is in Lebanon, let's look at a few statistics. On this axis, you have the morphine equivalent use in milligrams per capita. On the other axis, you have the year. This is 2010 data. Each circle is a country, and the size of the circle is the size of the population in that country. You see on the top Canada and the United States in blue. Their use of morphine equivalent per capita is about 700 milligrams. The light green dots are the European countries. You see Germany, for example, the use of morphine equivalent per capita is 376 milligrams. France, 220. You come to Lebanon, our use of morphine equivalent is 5 milligrams per capita, which is so sad. Because if you're suffering from severe pain and you live in the States or in Europe, you have access to morphine or other potent opiate, and you'll be pain-free. But if you live in Lebanon suffering from severe pain at home, no one can help you because you won't have access to morphine. The population of the United States, actually, the problem is not only in Lebanon, it's regional, actually it's international also, because the population of the United States is about 5.5% of the global population. The population of Europe is about 12.4% of the global population. So the United States and Europe together, they're about 18% of the world population, yet they are consuming 84% of the global morphine. Which means that 82% of the rest of the world are consuming only 16% of the global morphine. And we are part of these 82%. So the problem is really international. And also, in the region around us, for example, Saudi Arabia, they're at 5.5 milligrams per capita. Qatar, 2.2. UAE, 2.2 milligrams per capita. Iraq, 0.1 milligrams per capita. So obviously it's not a cost issue because all these countries, they're not there yet. So what is it then? Why we're not able to achieve a good consumption of morphine, meaning we're treating our pain well in our country? For two reasons. First, the law in Lebanon, as I told you, is extremely restrictive. Only oncologists and pain specialists could prescribe it. The other reason is we don't have the medications on the Lebanese market except one of them, like I showed you. Now recently, the Ministry of Health formed a palliative care committee. They're encouraging actually the pharma company to import all these missing medications to the Lebanese market, which is good, but it's not enough. Because even if today we have all these medications available in our pharmacies, on the shelves of our pharmacies, and no one is able to prescribe them, they will not get to our patients, and they will expire on the shelves of these pharmacies, and pharma companies are not interested to get them into Lebanon. So we absolutely need to change the law. But also, so we don't blame it all on our Ministry of Health actually, it's a cultural problem also. In our culture in Lebanon, you've heard it many times around people saying, well, I don't care about pain, I'm a man. Come on, you should not be hurting, right? Or you've heard people around you saying, well, I hate medications. I don't even take Panadol, I don't take Advil, right? I hate all this stuff. It's okay to be a little bit in pain, I can take pain. So we've heard this many and many times around us. And if someone is in severe pain and you tell him, take a pill of morphine, you'll feel better, he'll go, oh no, I don't want this stuff. Right? Morphine is something bad, it's something evil. And I kind of understand where these people are coming from, because all over the years up to 1998, the only patient who could get morphine was the patient who has cancer. No one else could get it in Lebanon. And if someone is in real agony, he needs the morphine, but he does not have cancer, the Minister of Health himself had to sign his prescription. Can you believe that? So in 1998, they changed that law. They replaced the Minister of Health by a pain specialist, but it's not enough. So, kind of, I understand really why these people think morphine is bad, because it's all linked to cancer. Morphine equal cancer, cancer equal morphine, it's evil, it's bad, I don't want it. But really, morphine is not bad. We are really fortunate to have a molecule that could treat our severe pain. WHO is recommending morphine. My dad went into a car accident. He fractured multiple ribs. A rib fracture is extremely painful because every time you're breathing, these fractured ribs are moving against each other and it's extremely painful. So I was still in the States at the time, so I called my sister, she's a pharmacist, and I said, what are you giving Dad for pain? And she said, I'm giving him Panadol and some Advil, but he's still in severe pain. And I said, why you didn't give him morphine? She said, we don't have access to morphine in Lebanon. I said, how about hydromorphone, Vicodin, Percocet? So I went through the whole list. And she said, what are you talking about? We don't have any of these in Lebanon. And my dad suffered 5 good weeks, every day with every single breath. And I started thinking, why we're doing this? 1 pill of morphine a day could have taken care of the problem. Why do we need to suffer in Lebanon? And some of you might ask me, really, do you want to give your dad 5 weeks of morphine? How about addiction? Right? It's a myth. It doesn't exist. If you take few pills of morphine, few days or even few weeks, you will not get addicted to morphine. I've had patients who had morphine for many months and they're not addicted, because the way we prescribe morphine is every time I see my patient in the clinic, I ask him about his pain score. And if he tells me my pain score is 2 to 3 over 10, which is good, then I cut down the morphine dose by half and we taper it down until he's pain-free. So the risk of addiction is myth, otherwise WHO wouldn't recommend it. So, how to do it? First, we need to know why really the Ministry of Health is really restricting morphine to only oncologists and pain specialists. Well, because they're afraid of abuse and misuse, and we understand that. But don't you think, for example, Europe and the United States and Canada, they're not also afraid of abuse and misuse? Of course they are. But they have a computerized system in place where they can link the prescribing physician to the patient, to the pharmacy, to the Ministry of Health, and they can immediately track any abuse and misuse. All what we need in Lebanon is to adopt the same system. We really don't have to reinvent the wheel here. So really, a digitized database is needed. After we do that, we need to change the law. We need to allow more physicians to prescribe morphine. I used to work in the United States. I used to prescribe tons of morphine because I used to work in a cancer center. Here I come to Lebanon. I chair the pain committee at AUBMC, but by the Lebanese law, I cannot prescribe morphine, which is so frustrating. But also, we need so we need to change that law, but also we need some education actually. We need to educate our healthcare providers how to prescribe morphine because they've never been used to it. But also we need to educate our fellow citizens, I think, that really it's not okay to be in pain. There is really no need for that. And I believe this is the biggest challenge. Thank you.